And then the way that we're going to measure the success would be an increased nutrition acceptability within the community. And this could be seen with the increased participation in referrals and people actually coming to the clinic. To monitor the success, surveys will be given to patients within the clinic prior to them leaving, including questions about the degree in which they learned. The number of referrals from healthcare providers will be collected in a database and calculated as well. For long-term evaluation, patients will be called to discuss the improvement on their allergy or intolerance and adherence to the recommended diet. To adjust the intervention based on negative findings throughout the evaluation, um, the plan of the PRN mentioned earlier could be established, maybe to get more business or as a secondary idea if we're not getting enough business with just referrals. Um, Also, we could add the addition of group classes as knowledge refreshers and also as a way to just um, push the community to communicate together about what they're learning and just grow in terms of relationships around the idea of nutrition. The key stakeholders that I interviewed for this project were Alyssa Sharp, Michelle Privet, and then Anne Suckney Souls. All three of these I had the opportunity to be a dietetic intern of. Alyssa works at the Iredell Wellness and Diabetes Center as a diabetes program manager. Through her interview, I learned that gaining referrals from healthcare providers can lead to trust of the participants to the nutrition clinic because people have so much faith in their doctors. And so if the doctor is telling them about a clinic, then it must be something that could work. She also recommended to start slow and grow. So don't just come in and want to see a ton of growth, but just trust that it takes time. I chose Alyssa because during my time with her, we talked a lot about food allergens and um, just the aspect of those affecting us in our personal lives. And then, as well as I got to see her do MNT with several clients who had food allergies or where she had to do an elimination diet. And then Michelle is an outpatient RDN at the cardiopulmonary clinic at Idell Memorial Hospital. I interviewed Michelle because I told Michelle about this idea when I was with her, and she loved it. And she actually gave me the idea of referrals. And so I just thought it would be great to interview her for this. Her recommendations would be to determine a focus population. So when I came to her with the idea, I was inclusive of all populations. And so after speaking with her, I narrowed it down to the pediatric population. And then she also advised me on advertisement and the importance of that. And within the clinic that she works in, they do a podcast. And so they've just seen great outcome with the podcast. And so she just gave me some different ideas with advertisement. And then Anne works at Nutrition Health Works and she specializes in GI. And so I was able to shadow Anne. And during my time with her, I saw many different clients come in with GI disorders where they had to be put on an exclusion diet. And I learned a lot in my time with her. And so that's why I interviewed her. And her advice was collaborations between doctors and dietitians is imperative, and that doctors tend to only read the the news about the evidence-based articles about what they're seeing now. And so there's not a lot about that in articles and evidence-based facts as far as nutrition allergies go. Um, so her recommendation was to, when I meet with doctors and healthcare providers, to bring them with facts about how um, different patients have done well off of exclusion diets and how these things are real and they truly can heal a patient. And then she also taught me about strategy with clients. And then if I place a client on an exclusion diet, it's always important to add things back in. We don't want our clients to go long term being miserable and then not be able to stay on it. But the overall goal of an exclusion diet is to be able to add things in. And these are my references.